welcome. I'm Dr. Catherine Taketa-Wong, a physician who believes that educating patients and the community is an essential part of a doctor's mission. Especially when it comes to autism, there is a major need for families to understand the medical aspects that can give rise to the behaviors that autism presents. What I'd like you to take away from my talk today is that every core symptom of autism can potentially be traced back to metabolic disorders. These disorders can be the underlying cause for symptoms that we typically associate with autism, including difficulty focusing and paying attention. We can also see other kinds of symptoms, for example, trouble with communication, tantrums, meltdowns, and aggressive behavior. When we treat the medical issues stemming from metabolic problems, autism symptoms can improve, and sometimes dramatically. As I'm fond of telling my patients, the notion that our body is made up as a sum of just individual parts is really a misguided notion. You're not just a thyroid gland or a stomach or a brain. I mean, you're a whole person. And as a result, you really have all of these different kinds of things that are interplaying, that can be related to each other. Now, one example of that is that problems with the gut bacteria can affect neurotransmitters in our brain that alter our moods. As you'll see from this event, that is especially the case with autism. Now, because every aspect of our body is connected, having the nutrients that we need is a foundation for health. However, in the United States, fewer than 20% of conventional medical schools require any courses in nutrition. Of those 20%, the typical offerings total fewer than 25 hours. That's 25 hours in 4 years, when most of our chronic diseases are food-related. Naturopathic doctors like myself typically receive 155 hours of nutrition. We are trained to educate and guide patients to build their health from the inside. So while I attended a 4-year medical school just like MDs and ordered lab tests, write prescriptions and such, I approach treatment comprehensively, including all aspects of the person's health, which is why my patient visits are 1 hour, not 10 or 15 minutes. It's a partnership for health between me and my patients. If you have a health condition that you would like to talk with me about, we offer a no-charge phone consultation. Please call our office to schedule that. There's no charge because I don't take new patients without reviewing their situation first and coming up with a plan to help you get better. All of the contact information is on our Facebook page, or you can click on the link in the post with this video. So moving to our topic for today, the metabolic system. So what is the metabolic system? The metabolic system includes several different glands and organs in our body. This includes our thyroid, the adrenal glands, liver functions, and more. With metabolic disorders, we see disruption of the normal biochemical processes that allow us to grow, repair damage to our body, and respond to our environment, processes that sustain life and the normal functions of our body. Now we'll get to all of those, but let's begin by discussing methylation. Now, methylation is one biochemical process that is the foundation for many other processes in the body. It includes the production and breakdown of neurotransmitters, which are brain chemicals. Those can affect attention, focus, language, mood, and behavior. Methylation is also the foundation for liver detox, which is the process of breaking down toxins and waste products and getting them out of the body. In addition, methylation is a foundation for maintaining hormone balance. Now, think about a building I like to give this analogy to explain what methylation is and how it works in our body. So if you think about a building, and if you think about, for example, the Leaning Tower of Pisa, there's obviously issues with the foundation of that building, right? If the foundation is cracked or crooked or damaged, then the whole building will be affected once it's constructed. And that is essentially an example of what we're seeing with the Leaning Tower of Pisa, right? The tower is like crooked and off to one side. Now, methylation is like our biochemical foundation for all of these different things that I talked about. So again, just to recap, it's responsible for making neurotransmitters, which affect our brain function. It's also a foundation for getting toxins out of the body and balancing our hormones and our immune system. A majority of children with autism have problems with methylation. That has been found in research. That means that they will have problems with brain chemicals, which is one of the reasons that their language, mood, and behavior can be different than many other people that we see. It can also be why children will have difficulty getting toxins out of their body. One result of having methylation issues is that children with autism will also be more vulnerable to damage from toxins, for example, things like lead or mercury or BPA. If the liver has difficulty with being able to break down and get toxins out of the body, those toxins can build up in the body and then start to cause a lot more problems with brain function, as well as other things in the body. Research has also shown that if methylation problems are corrected in children with autism, then their behavior, language, and mood improves, sometimes dramatically. The next metabolic condition that I want to talk to you about is something called oxidative stress. Now, what is oxidative stress? To explain it, I'm going to talk to you about something called free radicals and antioxidants. Our body makes these things called free radicals, which it uses to kill bacteria or viruses or things that could make us sick. Our body also makes antioxidants, which counteracts the effects of the free radicals. We're supposed to make free radicals when they are needed at a certain point, and then once, for example, an infection is over, then our body is supposed to stop making them. And then there are the antioxidants. Antioxidants have a job of calming down and clearing out all of these free radicals to help stop that inflammation so it doesn't get to be out of control. Oxidative stress is basically when there's an imbalance between the free radicals and the antioxidants. So free radicals, you could think of them kind of like little mini bombs inside of your body. Our body will throw these little bombs of free radicals at bacteria or viruses, things that could make us sick, to kill them. And the antioxidants are the things that like quell the fire and calm the, put out the fire on the bomb so that the bombs stop going off. So when there's too much oxidative stress, that means there's too many free radicals and not enough of the antioxidants. And that is one way that excessive inflammation can occur in the body. Research has shown that 68.9% of children with autism have oxidative stress levels that are too high. Oxidative stress, especially in the brain, has been linked to problems with brain function, which then can cause difficulty with language, mood, behavior, and so on. There are ways to correct those imbalances, which often lead to major improvements in their symptoms. I want to note that there is a similar phenomenon that often happens in people with Alzheimer's. So of course there's a great difference in age between children with autism and usually elderly people who have Alzheimer's, but we tend to see very similar differences in language, mood, and memory. So what is happening in the brains of individuals with Alzheimer's is that they also tend to have too much oxidative stress. There's too much inflammation that is going on in their body, which is negatively affecting their brain's ability to be able to function normally. And as a result, we see problems with language, with mood, and with memory. And same kinds of things, as we address and correct these things in patients who have Alzheimer's, we will often start to see improvements in things like language, their awareness, their behavior, mood, etc. Now I want to go and look at another issue, another metabolic issue that we see commonly in autism can be thyroid problems. Research has found that as much as 51% of children with autism may have abnormal thyroid function based on their labs. Now, by contrast, the incidence of abnormal thyroid function in neurotypical children is 0.02%, which is less than 1% of children with neurotypical function. Some symptoms that can be present in children with thyroid problems include constipation, speech and developmental delays, sleep difficulties, hyperactivity, or feeling tired all the time. There can also be problems with eating, focus, concentration, bedwetting, and a tendency to become anxious or depressed. Research has found that if a woman is pregnant and she has low levels of thyroid hormone, she is 4 times more likely to have a child with autism than if her thyroid is normal during the pregnancy. So this is something that is critical to look at in pregnant women to make sure that their thyroid function is normal at the beginning and even ideally prior to starting a pregnancy, because these are one of the things that we find that can be able to help to reduce the risk of autism in their child. I work with women before they get pregnant and during pregnancy with these kinds of things to help reduce the risk of their child having autism and just to help optimize their health and the health of their baby. Now again, when a child with autism is treated and we correct thyroid problems, then we often see a very significant improvement in their symptoms. Next, I will be telling you about autism and the adrenal glands, but I wanted to pause a moment to remind those who are just joining us that we offer a no-charge phone consultation so that you can talk with me personally about any health concerns that you may have and about how to feel empowered with your health. Arranging a consultation is very easy. All of the contact information is on our Facebook page. As a quick side note, if you are looking to purchase supplements, including ones that help to reduce damaging inflammation and provide your body the nutrients that they need for optimal health, make sure that they are third-party lab tested for quality. I invite you to check out our online supplement store. All the supplements in our online supplement store are third-party tested to ensure that they are high quality. However, this is also the only online supplement store you'll find where 100% of the proceeds go to supporting children for treatment for children with special needs, where you also get a 20% discount off of the regular prices, and again where they are third-party tested for quality. So this is at drtaketa-wong.com. That's drtaketa-wong.com, and you'll find the link in the post with this video. Now, going back to the adrenal glands and autism. The adrenal glands make a hormone called cortisol in response to stress. A significant number of children with autism have cortisol levels that are either abnormally high or abnormally low. If it's high, they can tend to be overweight. They could be in a fight or flight state all the time. They may also be irritable or have anxiety and have difficulty concentrating. They may also have headaches. Now, I've seen many children with autism who have difficulty being able to communicate what's troubling them. They're unable to say, my head hurts or my tummy hurts. And so instead, they may bang their head on the wall or on the floor because their headache just won't go away. or they engage in aggressive behavior towards others because they don't feel good, or they may also have self-injurious behavior where they bite or scratch themselves. I've also seen children where when we correct these underlying issues, then we see significant improvement in their aggressive behavior, their self-injurious behavior, in their banging the head on the wall or on the floor, because some of these children may have a headache and they can't say, my head hurts, and so it's coming out in their behavior. Now, I've also seen, going back to the adrenal glands, I've also seen children with autism who have too little cortisol. Now, if that's the case, they may have poor appetite, they may be tired all the time, they could have muscle weakness, they also could have difficulty with being able to focus and pay attention. So it's really important to have a doctor who is able to look at the child and be able to connect these symptoms that they're showing with potential underlying medical issues that they may be suffering from. And the last metabolic condition that I want to touch on is something called mitochondrial dysfunction. So what is that? It's a really big word, right? So mitochondria are these little things inside all of our cells that act as the batteries. They're the powerhouse for all the cells in our body. And if they start to have problems, you could think of it like when the battery on a toy starts to get low, right? And then the toy starts to run slower. It's like, it's running slower, right? And that's because the battery is starting to wear down. So if you have problems with mitochondria, it's like the batteries that power those cells in our body are starting to slow down. And so as a result, we start to see problems. So mitochondria that we see in children with autism most commonly affect things having to do with brain function. They can also affect the liver and the gut. And so they will start to slow down the processes that are happening in the brain, in the liver, and in the gut. And so what are the symptoms that we see? That may include things like developmental delay. We can see a child who feels tired all the time or who has very poor endurance, or they may get really grumpy or irritable after they have to keep going or keep working in therapy for a while or in school because they're feeling tired. But they may not be able to verbally tell you, I feel tired. Children with mitochondrial issues may also have seizures. They can also have digestive issues, especially constipation. So if you think about the cells that line our gut, those cells really need to be working to help move the food along the intestines. And again, if the battery powering those cells starts to run slow, then you're going to have food that is not moving along the intestines at the normal speed. It's slowing down. And so as a result, you can have constipation. These children may also have problems with the liver's ability to get toxins out of their body. So we may also see them develop skills and then lose them later on. So this can include skills with language, that can also include skills with function of their body, like running or jumping, or it can be any skill that they've developed. So they, again, may develop skills and then lose them later on. This issue, as with other metabolic disorders, is something that can respond to medical treatment. And again, as we treat these issues, we see their symptoms getting better. Now, when I treat a child with autism, I spend a lot of time with the parents to find out as much as I can about their symptoms. Based on that, I will order lab tests for the child to screen for any of the problems that are most likely based on their symptoms. That could mean blood tests, urine tests, and other tests. Treatment varies because it can be very different based on each of the symptoms and the medical conditions. However, in general, treatment will generally include specific foods to eat or not to eat, targeted third-party tested supplements, and also pharmaceutical medications if required. So what I'd like you to take away from my talk today is that autism symptoms are tightly connected to a variety of medical problems. When those medical problems are resolved, we see behavior improve. While many people aren't yet aware of the medical side to autism, we have the power to change our views and our decisions based on good, solid medical and scientific research. I trust that our discussion about the role of metabolic disorders in autism has been useful for you. Does your doctor take the time to educate you like we're doing here today? If not, you're welcome to talk with me personally about any health concerns that you may have, so that you too can feel empowered with your health. To do so, just call or text our office to schedule a free phone consultation with me. There's no charge because I don't take patients without talking to them first. I always want to make sure that what I do fits their needs. You'll also find all of our contact information on our Facebook page, and you can also click on the link in the post with this video. Also, be sure to check out our online supplement store. It's the only one where all of the proceeds go to supporting treatment for children with special needs, where you have trusted products and a 20% discount. It's at drtaketa-wong.com. That's drtaketa-wong.com. You'll find the link in the post with this video. Mahalo, thank you for joining us, and I look forward to seeing you again in 2 weeks. Aloha.